the future nurses, welcome back to Easy Nurse, where nursing education made easy. So, today Easy Nurse is present here as a midwifery and gynecology live. So, this live I am going to giving you some important questions from chapter 1 and chapter 2, which will be helpful for the quick preparations during your exam time. So, if you follow this live, you will get to know the more about content. Okay, so let's start today's live session. First, I am going to giving you regarding the introduction about maternity nursing and some terminologies. Okay, so maternity nursing, what? Maternity nursing is nothing but it is also one of the nursing specialization field which mainly focus on the care of the childbearing woman, like during the conceiving of the pregnancy, after continuation of the pregnancy, as well as after delivery of the baby. So they are mainly focus on the care of childbearing woman, especially the reproductive age group of the woman. How much age group? 18 to 45 years of the age group, as well as their families, through all the stages of the pregnancy, because during the pregnancy time a woman they needed the psychological support as well as the family support. And then childbirth, how they are going to giving the childbirth, what are the physiological changes are happening during the childbirth. So these and all they have to take care, and up to past 6 weeks after birth they are going to giving you or providing you some care. So these all are about maternity nursing. Now come to the some terminology or the definition. First is the midwifery. What do you mean by the midwifery? Mid means with and wife means woman. So midwifery is nothing but it's a art and science of the caring women who all are undergoing the normal pregnancy, labor and then period following the childbirth. So during the childbirth period there are so many periods are there. As example, first trimester, second trimester, third trimester. So each and every trimester they are gone through the many physiological as well as the psychological and hormonal changes. Okay, so at that time they have to provide the care, and a midwife is a person who have been regularly admitted to a midwifery educational program which should be recognized by the INC. So when you are studying the BSc nursing or GNM nursing, the college should be affiliated with the INC as well as particular state nursing council, right? So same as like a midwife course. Okay, so a midwife person, you can say the person as a midwife when she should completed any midwifery educational program from one institution that should be affiliated with the INC. Now come to the obstetrics. So what do you mean by the obstetrics? It derives from the obstetrics, this word. Okay, so the obstetrics is nothing but it's a Latin word. Obs means 8 and stare means woman. So it's a branch of medicine. You just remember obstetrics is nothing but it's a branch of medicine who all are going to providing the care for the childbirth women as well as who already given the birth. So who all are undergoing the delivery period and who are already given the birth. So for both of the people they are providing the some care or the medicines. So that related medicine study related to this branch is called the obstetrics. Now come to the obstetrical nursing. So obstetrical nursing is nothing but it's a specialization within the field of our nursing profession, mainly where the nurse works with the patient who are trying to become conceived, who all are already conceived, as well as who all are in the term gestation period to deliver, as well as who already delivered. So these 4 types of the category they are going to providing the care. So these all are about definition: midwifery, obstetrics and obstetrical nursing. So now come to the gynecology. What do you mean by the gynecology? Gyne means woman and logy means disclosure or the study. So gynecology is nothing but it's a study of the disease which is mainly related with the female reproductive system or the genital organ. Okay, so now come to the scope of midwifery. So you were studying this midwifery, as per the midwifery rules we are also providing some care. So what are the scopes are present into this particular branch? So first is the preconceptual care. Preconceptual care is nothing but through the midwifery branch we can provide we can help the mother and then family to make a transition to the parenthood, to maintain the good relationship, knowledge and commitment. So one new married couple, so for them what is the parenthood, what are the scenario of the parenthood, how they have to take about the responsibilities, that they don't have any idea. So through the midwifery, with the branch of the midwifery, as a healthcare workers, is our role to provide the proper knowledge regarding the parenthood. Okay, so that is called preconceptual care. Next is the support and protect the physiological process for the mother. Next one is the provide care of the woman during the 3 trimester of the pregnancy as well as the puerperium. So 3 trimester, first trimester is first 3 months, second trimester from 3 to 6 months, and next trimester or third trimester from 6 months to 9 months or beyond. So these all are the trimester period. So at this trimester period many changes are happening. So at that time what are the care is needed for that particular woman, that each and every care like screening, diagnosing, antenatal assessment, each and everything we have to provide. As well as during the puerperium period also, what are the care is necessary, what are the care is required to prevent any kind of complications or maternal mortality rate or morbidity rate, that also we have to do. So which period is called puerperium? So after providing the birth, so from that day to the up to the 6 months, up to the first 6 weeks of the period is called as a puerperium period. So at that time the mother is gone through the high chance of PPH or postpartum hemorrhage. So there is a chance to get, as well as any psychological problem, as example psychological blue, anxiety, then depression, many things. So at that time the mother is needed the proper assessment, proper attachment from the family members, that we have to provide. Next is prepare and educate all the expectant mother regarding the pregnancy journey. Next is provide the education about the care of child and about their growth and development. So for the child mainly they doesn't know how to feed the baby. Okay, what are the components of the breast milk, why this colostrum is needed for the baby, what are the types of breast milk, each and every type, why it is important for the baby, and why mainly is feeding is important for the mother as well as for the baby. So these and all basic education we have to provide to the family members, so they can relate the growth and development of the baby. So how it's related with the growth or development, how they have to assess by the age wise, like what are the nutrition they have to provide, what should be the monitoring tools to indicate like growth and developing is going as like a regular basis. So these and all basics needs we have, basic study we have to provide. Okay, next, trends of maternity nursing in India. So many are trends are following. So like first, economic issues and trends. Economic issues is nothing but like financial support. So some people, some family, they are belongs under the poverty line, right? So for them, whether they will not eligible to give the birth, obviously they are eligible to give the birth. So for them, the central government of India, they are nowadays they are bringing some policies. Nowadays they're bringing many new policies as well as many other things. From there they can collect the fund and they can go for the proper safe delivery. So these all are under economic issues and trends. Next is trends in healthcare settings. So mainly in the hospitalization. Like if we compare to the from first day and the nowadays, so that time you can see like first history, after giving the birth they were not allowing any parents with the children in the NICU or any special care unit. Okay, But nowadays what they are doing, they're allowing at least one single parent with that particular newborn baby in the special care unit or high risk care unit or anywhere. Okay, so these kind of many changes are happening in our healthcare settings. So these all are also under trends. Next is trends related to the technology. So nowadays with the help of the advanced technology, we can screening the process as well as we can assess the data or assess the disease conditions or any complications if it is present inside of the mother or for the fetus. What are the complication is present inside of the mother, which will be the leading cause of the complication for the fetus also. So with this the technology we can assess it and we can screening it, and as soon as possible we can treat it, right? So these all are under trends related technology. Now is the demographic issues and trends. So mainly the like demographic cycle is going to change due to the high population ratio, right? So for that many people from rural area to urban area they are coming. So migration is going on at a high level. So for that what is happening, like rural area, so for their communication technique is very less, as well as the healthcare facilities trends are also very less in those area. So the mortality and morbidity rates, these are going to increase in the rural area, and the urban area due to this migration and advanced technology they are going to improve. So these kind of the issues are happening. Next is trends of the patient involvement in the self-care. So previously the patient or mother, they doesn't have any right to choose the treatment procedure or the delivery modes of delivery system procedure. But nowadays as a healthcare workers, we are going to provide the higher authority first to the patient to choose what type of the delivery mode she want. Either she wants normally cesarean section or she want vaginal delivery. If there is any complication, so that time we can shift the patient for the cesarean section. So these kind of the communication first we have to complete to the patient. Now come to the other trends like socio-economic, cultural values and other ethical issues. Okay, so these all are about current trends of the maternity nursing in our India. So now come to the basic competencies of a midwife. So as a midwife person, what should be the basic competency? First is the general competency. So in the general competency is nothing but like how you will improve your fertility, how you will improve your reproductive age group of the period timing, how you will improve your sperm count, like you can provide them for that you can provide the more mature healthy sperm. So like this, what are the competencies are there, like what are the education are there for the nutrition, for the exercise or for maintaining the healthy lifestyle, that is under general competencies. Okay, now come to the competency specific to the pre-pregnancy and antenatal care. Pre-pregnancy in the sense like before conceiving the pregnancy, many tests are there nowadays to check whether the mother is or father is having any genetic disorder, either chromosomal or any other things or not, which might be the causing factor for the disease condition for the baby, means upcoming baby. So that we can specify it, as well as the antenatal care, means semester wise what are the, so as per the trimester wise what should be the care, that also we have to disclose to the mother. Next is competency specific to the care during labor and birth. So during the labor period the mother is getting so many pain, right, so much pain. So at that time what happened, like suppose for mother before completion of the 37 weeks of the gestation period, some mother they are having this labor pain. So that time it's called as a preterm labor pain. Okay, so for that what should be the condition, either you have to continue the pregnancy or else you have to give the birth of a premature baby. Okay, so what should be the treatment process, what should be the management, that it only depends based on the situation, based on the gestational age and then mother condition. Okay, so this kind of the complication if it is happen, so how you have to handle it, this kind of things you have to assess, as well as during the birth or after birth what should be your role as a nurse, that also you have to discuss with the mother. Last is competency specific to the ongoing care of the newborn as well as the woman. So means duration of the care after giving birth also, like in a puerperium phase what should be the treatment procedure, that is all under ongoing care of newborn baby as well as the woman. So these all are the basic competencies. So now come to the vital statistics. So vital statistics is nothing but it's a numerical form of the statistical ratio regarding the social factor. So what are the social factor? Like birth rate, death rate, specific death rate, neonatal mortality rate, neonatal morbidity rate, infant mortality, under 5 mortality, perinatal mortality, maternal mortality, as well as the general fertility rate. Okay, so what should be the equation? How you are going to assess the birth rate or death rate or any other social factor, that we have to discuss. First is the birth rate. So what should be the equation of the birth rate? Total number of the live births during that year, that should be divided by estimated mid-year population. So this numerical form will be multiplied by the 1000. So this is the equation of the birth rate. Now come to the death rate. So same as like a birth rate, like number of the deaths during the year, that should be divided by the estimated mid-year population, and that numerical form should be multiplied by the 1000. That is the equation of death rate. Now come to the specific death rate. Mainly the specific death rate is two types, age as well as the disease. Okay, so see the equation, like number of the death due to HIV infection, means due to the specific disease conditions. So that should be divided by estimated mid-year population, and this numerical form will be multiplied by the 1000. So it is like a disease specific death rate. Suppose if it is age specific death rate, so that time you have to say like number of the death within, suppose like reproductive age group, so 18 to 45 years of the age group due to HIV infection, estimated mid-year population of that same age group, that should be multiplied by the 1000. These all are two types of the specific death rate, one age and one disease. So now come to the neonatal mortality rate. So neonatal mortality rate or NMR is nothing but number of the deaths under 28 days of the age. Why 28 days? Because after the birth. So 0 days to 28 days is called as a neonatal period. So number of deaths under 28 days of the age, that should be divided by total live birth in a year, and that should be multiplied by the 1000. Now come to the infant mortality rate. So infant mortality rate means from 1 month to 1 year. So number of the death under 1 year of the age, so that should be divided by the estimated mid-year population, and this numerical form will be multiplied by the 1000. This is the equation of the IMR. Now come to the under 5 mortality rate. So less than 5 years of the age in a given year, that should be divided by number of the live births in the same year, and this number will be multiplied by the 1000. Next come to the perinatal mortality rate. So perinatal mortality rate is nothing but like number of the deaths which occurs 28 weeks of the gestation period or more than under 7 days after birth. So within this period how many deaths is happening, that should be divided by the total live birth plus stillbirth. Total live birth means how many baby has delivered, and stillbirth means how many death baby has delivered. So that numerical form will be multiplied by the 1000. So that is the equation of perinatal mortality rate. Now come to the maternal mortality rate or MMR. So maternal death, that should be divided by women of the reproductive age group. So that should be multiplied by the 1000. Next come to the general fertility rate. So general fertility rate or GFR is nothing but number of the live births in an area, that should be multiplied by the mid-year female population age 15 to 44 years in the same year in the same area, that should be multiplied by the 1000. So that is the general fertility rate. So now come to the female reproductive system. This is the most important topic to study regarding details about the midwifery, obstetrics and gynecology, right? So if you don't know about the overview of anatomical structure as well as the physiological structure of the female reproductive system, so how the delivery will be done, what should be the mother's physiological changes, you can't able to understand, right? So let's start about female reproductive system. So mainly this female reproductive organ is nothing but it's those which concerned with the population, fertilization, growth and development of the fetus, as well as its subsequent to exit to the outer world. So that is about overview of the reproductive organ. So mainly this female reproductive organ, they are divided into the three parts. First is external genitalia, internal genitalia and accessory reproductive organ. So now come to the external genitalia. So in the external genitalia, it's also known as a vulva. So all over part of this external genitalia, accordingly it's called as a vulva. So vulva is nothing but it's a composite name for the external genitalia. So the parts from outwardly visible. Okay, the parts of this external genitalia from outside you can see. So what are the parts? First is mons pubis. Next is the labia majora, labia minora, clitoris, vestibule. So under this vestibule there are urethral opening is there, vaginal opening is there, fourchette is there, as well as the Bartholin duct opening is there. So these are the four openings present under vestibule, and last is the perineum. So these all are the parts of the external genitalia. So now come to the mons pubis. So what do you mean by the mons pubis? Mons pubis is nothing but it's a triangular mound of the fatty tissue. So mons pubis is only present the fatty tissue which covers the pubic bone to protect the symphysis pubis. Okay, so it's nothing but it's a triangular structure, and only fatty tissue is present in the mons pubis, as well as it's mainly protect the symphysis pubis. So during the adolescence, sex hormones trigger the growth of the pubic hair on the mons pubis. So during this adolescent period as well as the teenage period, the pubic hair started to grow up on the mons pubis, and this hair is varies based on the from individual to individual based on the characteristics like coarseness, curliness, as well as amount, color and thickness. So these all are about mons pubis. Now come to the labia majora. So labia majora is nothing but it's mainly protects the introitus as well as the urethral opening. So labia majora, which is covered with the hair and then sebaceous gland. So only the labia majora is the part where sebaceous gland is present of the female genital organ, and it's also tend to be very smooth, moist, as well as the hairless. So mons pubis is fully covered by the hair, but labia majora there is no hair present. Okay, and it's become very flaccid with the age and after the childbirth. So now come to the labia minora. Labia minora is also known as a referred lips, inner lips of the female pelvis of the female reproductive organ. Okay, so it's mainly made up of the erectile connective tissue which is darkens and then swells during the intercourse period, and it's located inside of the labia majora and labia minora, which tightens the during intercourse period. So these all are the about of labia minora. So now come to the clitoris. Clitoris is very sensitive organ which composed of the nerves, blood vessels, as well as the erectile tissues. So during the sexual intercourse it's going to be very fluctuated as well as the swollen, and it's made up of a shaft as well as the glands, and it's very becomes engorged with the blood during the sexual intercourse period. So that's why it's become very swollen, and urethral opening which is located that's directly present below inside below of the clitoris. So that is all about clitoris. Now come to the vestibule. Vestibule is nothing but it is also triangular space which is bounded anteriorly by the clitoris and posteriorly by the fourchette, and either side by side which is present, that is labia minora. Okay, so these all are about the structure: anteriorly clitoris, posteriorly fourchette, and side by side labia minora. So mainly in the vestibule there are four openings. First is the urethral opening which is situated in the midline just in front of the vaginal orifice. Next is the vaginal orifice which is lies posterior end of the vestibule, and hymen is present inside of the vagina, which is a thin fold of the mucous membrane close to the circumference of the vaginal orifice, and the main protections of the hymen is nothing but from the microorganism from outside of the inner side. But after certain bugs or after cycling or anything after sexual intercourse, the hymen will be disappeared. Next, coming to the Bartholin ducts. So it's mainly lies posterior to the vulvar bulb and fourchette. This is a thin fold of the skin which is formed by the fusion of the labia minora. So fourchette is nothing but it's a fusion of the labia minora. Okay, and it's very inner deeply it is present. So from the outside you can't see the fourchette. So now come to the perineum. Perineum is nothing but it's a muscular area in between the vaginal introitus as well as in the anus. So the gap between vaginal introitus means last edge of the vaginal opening and the upper part of the anus, so starting edge of the anus. So this gap is called as a perineum, and it's mainly composed of a connective tissue, muscle and fat. So when a woman gone for the surgical procedure as like episiotomy during vaginal delivery, so the cut of this particular muscles and tissues of this perineum area is going to happen into this midline or the edge of the midline. Okay, so these all are about perineum. So now come to the internal genitalia. So in the internal genitalia is nothing but like the pelvic cavity it is present, which require the special instrument for the inspection. Okay, so what the consist of like vagina, one vagina is present, one uterus, two uterine tubes and two ovaries. Okay, so these all are about internal genitalia. So now come to the vagina. Vagina is nothing but it's a very muscular tube structure which extends upward and backward from the vulva to the uterus. So now come to the, it measures 3 inches long at a wide, and upper end of the vagina is very perceived with the cervix. Now come to the last point, the area of vaginal lumen which surrounds the cervix is mainly divided by the 4 regions: anterior, posterior, right and left lateral. So these all are about the vagina. So now come to the uterus. So uterus is nothing but it's a hollow space organ, pear-shaped organ with a thick muscular wall. Only muscles and tissues are present. So the uterus normally it's a 3 centimeter in long and 5 centimeter in wide and 2.5 centimeter in the thickness of the membranes. Okay, so it's the uterus is having the 3 parts, that is fundus, body and cervix. So this part is called fundus. From fundus to this up to cervix is called as a body, and lower part is called as a cervix. Okay, so these are the 3 main body parts of the uterus. So the functions is like a menstruations, pregnancy, labor and then involution. Menstruation means from the luteal phase, as well as by providing all the phases from the uterine layer the bleeding is coming to start it, so that is called menstruation. Pregnancy is nothing but uterus is the main organ which is helped to hold the baby, as well as implantations of the zygote, as well as the growing up of the baby and delivery of the baby, right? So labor, why this labor is like functions of a uterus? Because uterus is having one part that is called fallopian tube, right? From here fallopian tube is coming. So this part is called as a ostia, and this is also known as a pacemaker of the uterus. So from this ostia only the labor pain is coming to started from the outer parts to the lower side. So that's why labor is one of the main functions which is considered into the uterus. Next come to the involution, means after delivery of the pregnancy the size, shape, structure of the uterus again started to coming into the pre-pregnancy stage. Okay, so now come to the fallopian tubes. So in the fallopian tubes, this is the 2 main muscular tubes which is about 10 centimeter long, and it's extend from the uterine conduit outwards and laterally towards the ovaries. So from this part is called as a uterine conduit, which is coming to the outward, and laterally again it will rotate and coming towards to the ovaries. So parts is isthmus. So this part is called as a isthmus. Next come to the infundibulum. This part is called infundibulum. Then from here to here it's called as a ampulla, and from here to here this finger like structure is called as a fimbriae. So these all are about parts: isthmus, infundibulum, ampulla and then fimbriae. So ampulla is the one of the main structure which where ectopic pregnancy might be happen, as well as ampulla is one of the structure which helps to deliver the proper like fertilized ovum or mature ovum or mature egg to the uterus side, so the fertilization can be takes place. Now come to the functions. So transport the ovum from ovary to the uterine cavity, receives the spermatozoa for the fertilization and supplies the nutrition to the fertilized ovum. So these all are about the functions of fallopian tube. So now come to the ovaries. What do you mean by the ovaries? So with the fallopian tube, like oval shaped structures are present, right? So that is called ovaries. It's also called as a paired sex gland, and it is an almond shaped structure which is situated on each of every side of the uterus. So this measures approximately like 4 centimeter in long, 3 centimeter wide, 2 centimeter in thickness in size, and weight is 5 to 10 gram. So these all are about the anatomical structure of ovaries. So the structure is like a cortex, medulla and hilum. Cortex is the upper layer, our outer layer is called as a cortex. So inside the one thin layer is present, that is called medulla, and the inner side is called as a hilum. So functions: during this reproductive period, the ovary started to discharge mature the ovum to each and every menstrual cycle and produce the sex hormone like estrogen as well as the progesterone. One of the more important functions are there for the ovaries. What it is? Like before maturations of the female placenta, the placenta started to producing the estrogen as well as the progesterone hormone, right? So until the maturation of the placenta, ovaries, they are taking that plays a role like in production of the estrogen and progesterone. So at the same time, when placenta is going to mature, so after that the ovaries, they started to they stopped the producing this estrogen and progesterone releasing hormone. So that work is going to hand over to the placenta. So from that placenta, all the moisture nurturation as well as the maturization, everything is happened by the placenta. So these all are the most important functions of the ovaries. So now come to the accessory reproductive organs. So mainly this accessory reproductive organs is nothing but like female breast as well as the female pelvis. So these two are the accessory reproductive organs. Okay, so why it's called as an accessory? Because it is not directly connected with the female reproductive system or the genital organ, but still through the hormonal connection or through the pituitary like neurological system connection, it's stimulating the hormonal factors of the female body. So that's why it's called as an accessory reproductive organ. So now come to the breast. So breast, it is also known as a paired mammary glands in between the second and sixth ribs. So you just remember, breast is present in between the second and sixth rib cage of the female. So it's called as a like paired mammary glands. What is the structure? From outside to inner side to outer side. So thoracic wall, pectoralis major, lobules, lactiferous ducts and fatty or adipose tissue. Thoracic wall is the outer side. Next, pectoralis major, like this kind of structure is called as a pectoralis major. It's a muscle structure which mainly helps for the providing the nourishment as well as the blood supply. Next, come to the lobules. So lobules is nothing but in these lobules they are collecting they're secreting the hormone and producing the milk. So from the getting collections from the anterior pituitary as well as the posterior pituitary. So after that, lactiferous ducts. So when the milk is produced inside of the lobules, so when baby is sucking, so due to this the stimulation it is sending to the anterior pituitary, right? So from the anterior pituitary again it's sent back to the signal to the lobules, and from the lobules the milk is coming to the lactiferous duct and it is it is collecting into this duct. So after that, when baby is sucking, so from this duct the milk is coming to the baby's mouth. Now come to the fatty and adipose tissue. So these all are about structure of the female breast. These are the paired mammary glands in between second and sixth ribs. So now come to the female pelvis, which is most important topic for your exam, either separately or else for the as a viva questions or as a procedure. Okay. So female pelvis is a bony shaped structure, basin like shaped structure, right? So there are different kind of pelvises there. As example, gynecoid, platyploid, anthroploid as well as the anthroploid. So mainly this bony and ligamentous pelvis, what is designed to protect the pelvic viscera, support the vertebral column and pelvic girdle, which mainly helps to protect the viscera content within its cavity, and mainly it's help for the seating for the woman, as well as it also helps to to bear the weight of upper body parts while mainly the sitting as well as the standing period of time. So now come to the bones part of the female pelvis. So female pelvis mainly composed of the four bones. Four composed of bones is there. Two hip bone or ilium bone, one sacrum and one coccyx. So these are the main parts of the bone. Two hip bones or innominate bone, one sacrum and one coccyx. So now come to the innominate bone or hip bone. So this hip bone is also subdivided into the three parts. Upper part is called ilium, lower part is called ischium, and where this two innominate bone is coming and joint fused together. So this part is called as a symphysis pubis. Okay, so in the ilium part there are so many parts. So this part is called pubic crest. Okay, so from the anterior side, this is anterior superior iliac spine, this is anterior inferior iliac spine. This part is called posterior superior iliac spine and posterior inferior iliac spine. So anterior means front view, posterior means back view. So superior means upper and inferior means lower. So based on that you have to remember. So this is the front view. So anterior, and it is situated in upper side, right? So that's why anterior superior iliac spine. And same as like this is anteriorly, but it is situated into the downwards. So that's why this is anterior inferior iliac spine. Same as like posterior superior iliac spine and posterior inferior iliac spine. So these all are about the ilium parts, as well as along with this, like here one structure is there like ala wing structure. So that is called ala wing structure, and here this part is called as a sacral promontory. So these all are the parts of the ilium. Now come to the ischium. So in the ischium, so these are the two parts, right? This kind of parts. So this is called ischial tuberosity. This whole holly parts, bones parts is called as a acetabulum, and this hollow structure it's called as a obturator foramen. Okay, so these all are about ischium part. As well as along with this part, one spine is there. So here both side you can see like U-shaped structure. So that is called ischial spine. So as well as two sciatic notch is present. So greater sciatic notch and lesser sciatic notch. Greater sciatic notch which runs from the posterior inferior iliac spine to the ischial spine. That is called greater sciatic notch, and lesser sciatic notch from the ischial spine to the ischial tuberosity. So that is called lesser sciatic notch. Now come to the symphysis pubis. So from the symphysis pubis, if you imagine as like a 360-degree angle of the female pelvis, so that time you can see like upper structure as well as the lower structure, right? So this upper part is called superior rama, and this lower part is called as a inferior rama. So these all are about innominate and hip bone like ilium, ischium, symphysis pubis and their subparts. Okay. Now come to the sacrum. So sacrum is nothing but it's a wedge-shaped bone which is consisting of the 5 fused vertebra bone, as well as it has a 2 ala wing structure. The front part or this anterior part is very concave, very smooth, as well as which referred as a hollow of the sacrum. Same as like a posteriorly or the back view is very rough, and it mainly helps the attachment of the muscles or the ligaments. Okay, so that is called the sacrum. Now come to the coccyx. Coccyx is nothing but it's also known as a tailbone, and it's a triangular shaped bone which is connected with the sacrum, and it's a 4 fused bone. Okay, so these all are about coccyx. Now come to the joints of pelvis. So joint means where 2 bones fuse together. So this part we called as a joint, right? So joints of pelvis means symphysis pubis, where 2 hip bone is fused together. So this part is called symphysis pubis. Now come to the sacroiliac joint, where sacrum and then ilium bone is fused together. So this part is called sacroiliac joint, and sacrococcygeal, where sacrum and coccyx is fused together. So this part is called sacrococcygeal joint. So mainly in our female pelvis there are 4 joints. 2 sacroiliac joint because it is present in both sides, 1 symphysis pubis and 1 sacrococcygeal joint. So now come to the ligaments. landmarks of the pelvis. So what is the landmark? So when you are describing this landmarks, you can say like from anterior to posterior onwards or posterior to anterior onwards. Okay, but now I am saying you from anterior to posterior onwards. So first you can see like as per rotation wise like 360-degree angle, if you can imagine this structure, so then you can see like first is the symphysis pubis where it is joined, right? After that pubic crest, then pubic tubercle, then pectineal line, then come to the iliopubic eminence, again one line that is called iliopectineal line. Next come to the joint, sacroiliac joint. Next come to the ala type of structure that is called ala wings, and upper structure that is sacral promontory. So these all are the 9 landmarks. You have to go through about the female pelvis, then only you can understand what are the parts are present. If you can't go through about the female pelvis, if you not study about the female pelvis thoroughly, you will not able to solve any kind of problem which is related with the female pelvis. Okay, so first is landmarks is symphysis pubis, pubic crest, next is pubic tubercle, then one line shape structure is present, so that is called pectineal line. Then one like hollow stripe, hardy stripe structure is present, that is called iliopubic eminence. Again one line came, that is called iliopectineal line. Next coming is joint, so sacroiliac joint, then ala wings and sacral promontory. So these are the total 9 landmarks are present of the female pelvis. Okay, so you just remember this pelvis I am going from one side, so it is present on both sides. Okay, so now come to the ligaments. So ligaments is nothing but where two joints are coming and attaching with each other. Okay, so that is called ligament, right? So same as like a interpubic ligament, means the in the symphysis pubis area. Next come to the sacroiliac ligament, so where from sacrum to the ilium, so that is called sacroiliac ligament. Next is the sacrococcygeal ligament, so in between sacrum and coccus. Next is the sacrotuberous ligament. So sacrotuberous ligament is nothing but in between the sacrum and the ischial tuberosity. Ischial tuberosity. So this ligament is present. So what will happen? It will provide the more support to the female pelvis. So that is called sacrotuberous ligament. Now next come to the sacrospinous ligament. It's present between sacrum as well as like ischial spine. Okay, ischial spine which is present of the ischium part of the hip bone. So that is called sacrospinous ligament. So what are the joints are present? Same type of ligaments also present. Like so joint is 3. So same as like ligaments, interpubic, sacroiliac, sacrococcygeal. Only for this ligament 2 is extra. First is sacrotuberous and second one is sacrospinous. So sacrotuberous is present in between sacrum and ischial tuberosity, and sacrospinous it is present in between sacrum and ischial spine. Okay, so now come to the parts of pelvis. So mainly of the female pelvis is consist of the 3 parts. Upper part is called as a pelvic inlet. This upper part is called pelvic inlet. Mid part is called pelvic cavity, and this lower part is called as a pelvic outlet. So in the inlet part or the brim, it's covered mainly the sacral promontory, ala wing, sacroiliac joint, iliopectineal line, iliopubic eminence, pubic crest, pubic tubercle, and symphysis pubis, or the both side. Next is the pelvic cavity. It mainly cover up to the level of ischial spine, not till the level of ischial spine. Okay, next come to the pelvic outlet. Pelvic outlet covers the tip of coccus, ischial spine, ischial tuberosity, obturator foramen, each and every part of the ischium is the lower part. Okay, so that is called pelvic outlet. So mainly through the pelvic outlet the baby is sweeping outside, right? So these all are the parts. So now come to the diameters of the pelvis. So first we will discuss about pelvic inlet or brim part. Okay, so in this the brim part there are mainly 3 types of the diameter is present. First is anterior posterior diameter, oblique diameter, and transverse diameter. So under this anterior posterior diameter there are also subtypes, 3 types, that is anatomical, obstetrical, and then diagonal. So anatomical is nothing but it extends midpoint of the sacral promontory to upper point of the symphysis pubis. So midpoint of the sacral promontory to upper point of the symphysis pubis. So that is called anatomical conjugate and it measures as around 12 centimeter. Now come to the obstetrical conjugate, which is present from midpoint of the sacral promontory to midpoint of the symphysis pubis. So it measures around 11 centimeter. And diagonal conjugate, it's present from the midpoint of the sacral promontory to lower point of the symphysis pubis. It measures around 10 centimeter. Okay, so these all are about anterior posterior diameter, anatomical, obstetrical and conjugate. So sometimes they will ask you as a external, especially during the viva exam, what are the anterior posterior diameter is present in the female pelvis. So that time you have to tell as a brim part as well as the outlet part. Okay, but if they're asking as a regular question anterior posterior diameter of the female brim, so that time you have to disclose only these three parts. Okay, now come to the oblique diameter. Oblique diameter is present from one side of the sacroiliac joint. So this part is called sacroiliac joint, right? So from one side of the sacroiliac joint to opposite side of the iliopubic eminence. So this called as a oblique diameter and that is the 12 centimeter in measures. Now come to the transverse diameter. So transverse diameter is present in between the two iliopectineal line. So in between two iliopectineal line it's present and it's and it measures around 13 centimeter. So it is the largest diameter of the female pelvis brim part or the inlet part. Okay, so that is the all diameters of brim part. So now come to the cavity. So in the cavity, as I said, up to the level of ischial spine, the hollow space is called as a pelvic cavity, right? So from the each and every aspect of the 360-degree view, its length around 12 centimeter and depth is 4 centimeter. There is no other anterior, posterior or any other oblique or transverse diameter. Okay, now come to the pelvic outlet part. So mainly in the pelvic outlet part there are two types of the diameter, anterior posterior as well as the transverse diameter. So anterior posterior, which is present from the lower tip of the coccyx to the lower point of the symphysis pubis. So that is measures around 13 centimeter, and transverse diameter, which is present inside in between of the ischial tuberosity. In between ischial tuberosity it is present. Okay, so this is the female pelvis hip bone. So in between ischial tuberosity this diameter is present, so that is called transverse diameter and it measures around 11 centimeter. Okay, so these all are about the female pelvis as well as the structure and then diameter. So in this session I gave you more important questions about the first unit and then second unit. Okay, so go through about this. So thank you, hope you all understood my session. Again we will meet in next session. Till that, keep learning and stay tuned with the easy NAS. Thank you.